Good afternoon, everyone, and happy summer. It's hard to believe that this is our sixth Move the Needle of the year. And today we are focusing on a very important issue, mental health in America. We really want to understand the impact and most of all, identify hopeful solutions. I'm Stacey Blakely. I'm the Executive Director of the Policy Circle. We are a nonpartisan 501c3 organization, and we're really focused on providing pathways for women to become courageous and informed citizens who take ownership of solutions to the issues facing their communities. So we're so glad that you joined us again today. And we want to thank our influencer network partner, Ara Lee Weldon. Thank you, Ara, for supporting our program today. And thank you to all our network collaborators. With your support, we're reaching new audiences and sharing this valuable information. So thank you again to all of you. Today's discussion focuses on a Policy Circle brief that was just released on mental health. If you haven't had an opportunity to read the brief, I really encourage you to do so. We'll have the link in the chat. Wait till after the program. Our briefs at the Policy Circle are carefully constructed and vetted. We use reliable resources. We consult with experts and members like you to ensure that we provide an overview of the issues, the impact, the measures for success, and in this particular case, proposed reforms and innovations. Today, we cannot cover all of that. So our conversation is really going to be focused on the impact of COVID, adolescents, access to care, and some new and innovative ways that we can provide more treatment options. So the goal for us, really any of our Move the Needles, and really with the Policy Circle, is we want you to come away feeling equipped so you can tackle this issue even in your home, in your community, but you can do it with knowledge and compassion. Mental health affects how we think and feel and act. It impacts every facet of our lives. It hits particularly close to home for me. I'm the parent of a teenager that suffers from severe mental illness. But I imagine that most of you that are on this call today have been impacted in some way by mental health. It's imperative that we prioritize this individually, as families and communities, and ultimately for our entire nation. The statistics are sobering. 51.5 million US adults experience some type of mental illness each year, but fewer than half receive treatment. Likewise, for teens, we've got 45% of teens are suffering from a mental issue. And 1 in 5 actually suffer from severe mental illness. It's important that we understand the distinction between suffering from some mental health issues versus extreme illness, and we're going to get into that during the program. This carries over into business. The Hartford just sent out a new report that HR groups basically report in that 70% of these employers now recognize that mental health is a significant issue, but 72% say stigma prevents getting help. Pre-COVID, talk about a loss in our economy. There is $1 trillion in economic loss each year in productivity for just anxiety and depression. But there's something hopeful. Those same studies show that for every dollar spent on evidence-based care, we have a $5 return. So there's extreme motivation, right, from personal, professional, our school settings to really tackle this issue and to do it well. But with all these statistics, I think we need to remember there are individuals, their lives are at stake and their well-being is so important. So let's hear from some teens about the impact of COVID.
I've always struggled with my mental health, but it's been more prominent than ever. Having to combine the negative thoughts that clutter this space with the stress from classes is just the perfect mix for a disaster, if I'm being honest.
I feel like I'm trapped within my own mind. No one can hear me. I feel like no one knows who I am. I don't like this feeling.
Freshman year is something that's always given me anxiety, so not having a social life honestly isn't that horrible for a more introverted person such as myself.
School and my home life is basically one and the same, so I really miss that, when you used to, school just ends and then boom, you can come back home, chillax.
While I'm trying to stay optimistic, I'm still anxious about what will happen next. I plan to go to school a few days a week in October for a hybrid learning situation, but things change so fast that I honestly don't know what will happen.
you never really realize how long a day is until you go back to school again and you're wearing a face mask and you can barely talk to anyone and it's just you and your brain, and it's pretty rough.
I struggle with anxiety and depression, and I do suffer with mental health issues. Someone listening and having that love, support, and encouragement is appreciated, and I think that's what I want or sort of need right now.
Wow, I love hearing directly from those teens. And I'm really excited to welcome to the Move the Needle, Andy Keller. Andy is the president and CEO of the Meadows Mental Health Policy Institute, a nonprofit organization that provides nonpartisan policy and program research to improve mental health care delivery in Texas. He's a licensed psychologist with 20 plus years of experience in behavioral health policy, finance, and best practices. Welcome, Andy.
Hi, Stacey. Great to be here.
Well, we certainly appreciate you taking time. And I think even with that video, it makes us realize that the impact of COVID, even as we emerge from this, is going to be with us for quite some time. So I think really kind of the first thing I'd love to ask you to do is really kind of set the stage for us. Sort of where are we in terms of mental health as we emerge from COVID?
Yeah, well, there's sort of a bad side and a good side. So, before COVID, we were not doing real well with our mental health, particularly among our youth and our young adults. We had suicide rates at all-time highs that were growing in almost every group, and particularly growing among young people. Suicide is now the second leading cause of death among young adults, behind accidents. So, young people in their 20s, 30s, adolescents who are otherwise at the healthiest point in their life are suffering at unprecedented levels. And that was before COVID. And then what we see post-COVID, I think we're going to see several different waves. So during COVID, the CDC tracks on a weekly basis depression and anxiety rates, and they were 4 times any historical average before. 40% of folks plus, depending on what group you're in, were experiencing some level of anxiety or depression. And those were the main things that were going up, along with, we saw very big rates of addiction increases. So that's moderated a little bit. They're now only 3 times historical averages as we come out. And I think pressure's off in many ways. Some of the stress is gone. But what we tend to see after long chronic exposures to extreme stress, if you take, for example, folks who go fight a war for a year, we really don't see the major mental health impacts until folks come home. Because during the crisis, being more anxious, being more sort of keyed up is actually functional. It helps you get through, you're exhausted, but you kind of get through your day. And what we see is then when we try to go back to normal and we don't really find normal, that the normal we had before COVID, that's not what we're going to be living in, not for any time soon. So really for the next few years, we're going to see lingering effects, probably some deeper effects. So, those are the main things, Stacey. I could go on and on. But the good news, though, is most of these illnesses are treatable. And I think that we saw a heightened awareness of the impact. Those young people were so articulate. And I think young people in general are more willing to view their mental health as part of their health. But I think we have an awareness that will help us going forward.
Yeah, I think that transparency is definitely, you're going to see that more in the younger generation for sure. So, I think that goes a long way to saying some of that stigma, right, that's been present in past sort of generations is fading. I want to talk about stigma in a few minutes, but before we get there, let's talk about sort of the disproportionate impact. So we have some of these statistics, right, that's kind of across the board, but we have particular groups that have suffered perhaps more than others. Can you highlight that for us?
Yeah, I think if we look, and we see this here in Texas, and I'll try to use those examples, but so among Latino Texans, Hispanic Texans, working age Latinos in Texas suffered 4 times the rate of death from COVID as other groups. So when you look at the grief impacts and the stress impacts from that, it's just, that begins to calculate. We also know that people of color disproportionately experience poverty, disproportionately experience sort of jobs where they may not have leave, may not be able to take time off, may not have the same flexibility that I had to do my work by Zoom. So those stresses of having to go out and face people, deal with mask wars, deal with all this uncertainty, folks had to kind of carry on, and we definitely are seeing that. And then also the recovery of jobs is leaving some groups behind. The unemployment disproportionately fell on people of color and women, and we're seeing that the recovery is also disproportionately impacting different groups. And I do think women are a really important group to look at too. And I know we'll talk about that more, but one of the most startling statistics that just came out last week was that most of the rise in emergency room use by young women and adolescents, or by young people and adolescents in general, were young women. 50% increase versus only about a 5% increase among boys and young men. So there's very big disparities.
So 50% versus 5.
Correct.
Wow, that is really that's pretty incredible. I mean, and one of the things you pointed out that I heard you mention when we talked before was this suicide rate correlated to the economy. And it really just sort of struck me, right? The job numbers come out and everybody talks about it, but there's this real human cost associated when people don't have employment. Can you talk about that a little bit?
Yeah, when we've looked at past economic recessions, we looked at the Great Recession in 2008, economists found that and the clinical folks found that there was a real correlation between unemployment and risk for suicide. And what we don't see, though, is that going away when jobs come back. And so that puzzles economists. But clinically, here's the reason. It's like you go to war and you come back, then you have PTSD. Well, the war's over, but you went through something that was really traumatic, really sort of rocked the foundations of your life. Also, there's real practical things that happen when you're unemployed for 8, 12 months. Relationships suffer. Sometimes you lose your housing. So there's a spiraling effect. So there's a lot of reasons why just the experience of unemployment unexpectedly just adds additional toxic stress, which is one of the biggest drivers of mental illness and addiction. And addiction, Stacey, we can't leave out. I mean, we had a 1/3 increase, 33% increase in deaths from overdose during the pandemic.
Wow.
I mean, it's startling, the statistics.
And that's so much of that is obviously people not getting treatment, treating themselves, numbing the issues, right? So, I mean, that's just a natural carryover. I mean, that's a whole other, we could have a whole other program, right?
For
on
sure.
how it translates, because that's such a massive issue. Talking about that, that's a good segue into kind of our next sort of topic, right? Which is access to care. So people not getting access, obviously you have some of those horrific outcomes. We shared that statistic earlier that fewer than half of the, adults that have any mental illness get any kind of treatment. Can you help us understand why that is?
Yeah. And I think maybe this would be a good time to show that other side, Stacey, so I kind of show how we organize ourselves for.
Yeah.
So for most physical health conditions, so I have heart disease risk in my family. So they did not wait until I had chest pain. They started measuring my cholesterol, I think as soon as I turned 30. It's been a long time, 30, 35, somewhere around there. So for 20 plus years, I've been in treatment to prevent heart disease, focusing on my cholesterol, focusing on exercise, diet, all of that. And all of that happened in primary care. Contrast that with my grandfather, who had a heart attack in 1976, actually died for a few minutes. They resuscitated him, got him out of his coma. When he came home, that's when they started dealing with his cholesterol. So that transition from waiting until a crisis until we get to the point of being able to or intervene earlier is what we've made for heart disease, cancer, diabetes. We haven't done it yet for mental health. What we do with mental health is we wait till you notice the symptoms or someone else does. And so on average, we wait 8 to 10 years, and your needs are deeper then. They're much more severe, much harder to treat. And also we tend to send people straight to a therapist. That's not how we dealt with heart disease. We didn't train a million new cardiologists. We put early intervention into primary care. And that's really what research shows is the most effective way, because 80% of mental illnesses are mild to moderate. They're like my anxiety disorder, which is, not something I need to go to a hospital for, but anxiety is often the early stage of all sorts of mental illnesses. Like bipolar disorder looks a lot like anxiety early. Psychosis early on. People don't wake up one day and hallucinate. They don't wake up one day and be suicidal. That starts and it evolves over years. And so we wait too long. And that's the biggest reason that we have this access problem.
Well, and I think it's interesting because we just had Pat put a question in the chat that plays right into this. Can our healthcare system ramp up, right? Can we provide access to care? And I think you're answering that a little bit, and it's how we approach it, right? Can you kind of address that capacity question?
Yeah. Well, so let's think about this. A year ago, we had zero capacity. Well, not a year. 18 months ago, we had zero capacity to detect COVID, zero capacity to treat COVID, zero capacity to prevent COVID. And in 18 months, we decided that we were going to thwart COVID. And we have. I mean, we still have a lot of problems. There's a lot of folks who haven't been vaccinated, but we have the tools and we're through it. And we've got, I mean, my gosh, I've been tested. How many times have I been tested for COVID? I mean, we've all been tested dozens of times. And so, or we could be. So we ramped that up in a year. We have all the same tools for mental health available. We can detect 85 to 90% of depression and anxiety with existing tools, taking a brief screen in a primary care office. It takes less time than it takes to take your blood pressure. We have billing mechanisms available called collaborative care that Medicare put in place in 2017 that every commercial payer covers. Heck, Texas just added it to its Medicaid system. So if that tells you it's mainstream, that should tell you it's mainstream. So we pay for it now. We just have to retool our health system. So we're in the middle of a big retooling in Texas to do that. There's many efforts across the country that are trying to do that, to basically do what we did for COVID, put detection and early intervention and evidence-based treatment in the primary care office. And it saves $6 to $1 over waiting 8 years, which it's not rocket science. Like, you wait, things get worse. You intervene early, things are better. I mean,
well, and when we talk about making this a priority, right? Kind of like, will, there's a will, there's a way. Political will is a whole different topic. So let's talk about current resources. So there is, what, 2.5 billion in block grants go to the states. I think it'd be so helpful, Andy, if you would sort of set the framework for us so we can understand how this federal funding is funneled, and especially, let's say, for the uninsured at that county level. There's always that question mark, right? What are we spending and what kind of results are we achieving? So would love for you to sort of paint a picture.
Yeah, absolutely. Well, you do a great job in the policy briefing, and I would encourage people to read that, where you kind of walk through the history of mental health care in the United States. And there was a big shift away from hospitals to the community in the 1960s. And for a long time, the federal government, through the Reagan administration, covered that as an entitlement. In the 1980s, the federal government shifted that to a block grant. And really, but a lot of the policy of the federal government has not changed all that much, because they still basically use that $2.5 billion, which actually was ramped up pretty big for the next couple of years because of some of the COVID legislation. It's actually about 3 times that for the next 2 years. And we'll see what the Biden administration proposes going forward. But even if it's $5-7 billion, it's a drop in the bucket compared to what we spend on mental health. So one thing that I think would be helpful, and we're starting to see that shift, is that the federal government did that more as a way to invest in infrastructure and building. They did that since the 21st Century Cures Act was passed in 2018, by focusing on something called early psychosis treatment, which tries to find people and aggressively treat their psychosis as soon as it emerges, rather than wait 4 or 5 years like we usually do. Psychosis is a very severe mental illness. And what we saw was that 5% set aside in the block grant was used to dramatically increase capacity around the country. So one thing we need to really, I think, recognize is really the main funder of care for people in poverty is going to be at the state level and through the Medicaid program. Those are the 2 big programs, somewhat Medicare. And so, in Texas, we use a mix of both. All states use a mix of both. Some use more Medicaid, some use less. Texas, we use a lot of Medicaid for children. We don't use it so much for adults. We really depend on local government. Counties really bear that burden. So it's kind of a hodgepodge. And, it's interesting, too. Some of the most evidence-based services are actually more available through the Medicaid program than they are through my private insurance. If I had a psychosis, and I was in the public system in Texas, it would be much easier for me to find someone to get my coverage paid for, my care. When my private insurance won't pay for that, I have to pay out of pocket for it.
Yeah, and I think that out-of-pocket component, I can speak to that personally, but that's a huge issue, because for folks, even if they have insurance, that access to care is still really an issue, because certain things aren't covered, or people get listed in networks, but they're not actually in networks, like a ghost network out there. Network. Yeah, and so that's something I discovered recently. I didn't know there was a ghost network, but it makes it look like they have a lot of providers, but then actually they're not available taking any clients, right? So, I mean, that's another access issue, even if you do have insurance, that I think has to be addressed at some point. At that level, right, when we're trying to understand, right, at our community level, what do you think is a great resource for the folks that really want to understand what's being spent, where the resources are concentrated? Because obviously people are participating on this call from all over the country. What's a great way for somebody to just get to know the sort of landscape of mental health in their community?
Well, it's mind numbing. I mean, we have 19 different funding streams that pay for mental health in Texas, and most states are that way. The juvenile justice system pays for a lot of mental health, the child welfare system, the educational system. So, one thing we've really tried to encourage people to do is look at your local health systems and what is their status for, the primary care doctors in your community, regardless of whether you're looking at the public sector or the private sector, are they screening and detecting? What are the leaders in your health system? I mean, many of the people on this call are leaders or no leaders, and what are they doing to kind of more proactively detect? And I do think, understanding the funding is important. And frankly, I think your policy briefing is a great overview. But the problem is, if you want to go more in depth than what y'all did, you're going to have to go state by state, because every Medicaid program is different. Every configuration, I mean, they're all the same in the sense that they're a mess and they're really confusing, but they're confusing and messy in different ways. So, certainly in Texas, we're a resource. There's other groups, NAMIs, Mental Health America chapters can often be helpful for providing information.
Well, and I think what you pointed out, which I think is really important, is, a universal issue across is that detection and some of those really fairly simple things that can be done to have that integrated care. So we are going to come back and talk a little bit more. And right now I want to kind of shift gears and let's talk to Dr. Bobby Wegner. And Bobby, I can't wait to have you guys meet her. She is a clinical psychologist and lecturer at Harvard. She's an author and international speaker and co-founder of Groups, which is an online mental wellness platform that brings people together to talk about real issues with the help of a facilitator. Dr. Wegner also serves on the board of USA for IOM. This is a UN migration agency, and she brings a wealth of knowledge as a practitioner and a scholar in this issue. So welcome, Bobby.
Hi, Stacey. Thanks for having me. I'm really excited.
We're delighted to see you, and thanks for making time for us today. I think I want to kick this off. I mean, you're a mom. You also treat adolescents. And, when we start seeing that even in this childhood bracket, right, that 1 in 6 youths age 6 to 17 are experiencing a mental health disorder, I think that's a real eye opener. Would really love for you to kind of set the stage for us to talk about this youth and adolescent component in terms of what does the landscape look like right now?
Yeah, I think that's a very important thing to think about, both for me as a parent, but also a provider. And so before COVID, what we really knew was that our kiddos were struggling in many ways. And you hear the word mental health and you can think like, I don't even know how to conceptualize that. Like, what is that? And there's really a spectrum of mental health and mental wellness, and really taking stock of like what that means and where you are and where your family is and where your child is. But what we know before COVID is that I think it's actually 1 in 5 kids aged 3 to 17 had a diagnosable mental health issue, which is huge. And that doesn't even cover kids who don't meet criteria, right? That's if you have a diagnosable disorder, and 20% of those kids were not getting any services at all. And then now add COVID, which is, really think about COVID as a cultural trauma. And Dr. Keller really referred to this, kind of using the metaphor of soldiers, but we've just gone through a cultural trauma as a country and as a world. And what that really means is there are increased rates of anxiety, hypervigilance, stress, and our kids feel it. So they're already struggling at baseline. And so it's pretty normal. It's a normal response to an abnormal event for them to be feeling more anxious, more off kilter, therefore more struggling in school. How can we expect our kids to go back to school when they're all dialed up and anxious? That's not how our brain works, right?
Right.
If you're feeling anxious, then you can't be present to learn. So, with that said, kids experience things differently. So it's not really one size fits all. So I'm not saying this to be an alarmist and scary and, have you look at your own kids and think you're missing something. Some kids weathered this just fine. But we do know that COVID has been a cultural trauma, and we were already, not doing so hot in the mental health front with our kids. And, we're probably a little bit worse off, or we know we're worse off than where we started.
Well, and I think, one of the things that you talk about is being, proactive, right, instead of reactive.
Yeah.
And like Dr. Keller said, I mean, this has brought attention to the issue, which is great. And we do have increased funding for the next couple of years. Also a silver lining, if you will. But can you kind of take us through sort of the landscape again of like, how can we be more proactive and preventative versus this reactionary to things that have gone on, like Dr. Keller said, after something's been manifesting itself for several years, that preventative and proactive piece is so valuable. So can you talk to us a little bit more about approach?
I think that's really great. And I just love, so Dr. Keller's really coming at this from a research kind of background. And I really approach things from more of a clinical kind of perspective, but we're both singing the same tune and seeing the same thing. And Maddie, if you're listening, would you mind going to that the physical mental wellness curve? Because I think the way people think about mental health and they think like, oh God, what is that? That sounds so daunting and terrifying. And your mind goes to suicide and depression. But you really have to think about mental health is a very normal part of just whole health, whole person health, right? And if you think back 20 years, we thought about physical health actually in a different way. No one really worked out unless you had a major medical condition or needed to lose a whole bunch of weight. And now we know it's really important to go for a jog and take care of our bodies and our minds in a different way. But that really hasn't translated to mental health. And Dr. Keller spoke about that a little bit. And so we really have to think about like therapy and intervention when you're struggling when your needs are a little bit higher. Those services are super, super important, and I don't want to minimize that at all. But there's a whole bunch of us that are just kind of like everyday people who don't necessarily need therapy, but could need to deal with their mental health from a preventative model. So just like you go to the gym and you work out or do a 20-minute or 30-minute jog, there are things we can do to be taking care of our mental wellness in a preventative way. And you talk a lot about it, the policy circle, like mental health affects how we're thinking, how we're feeling, and how we're acting. So really tuning into those parts of our lives.
Yeah, and I think it would be interesting too. You had a slide that I wanted us to focus on where you kind of talk about, modern mental health. So Maddie, let's put that up and have Dr. Wegner kind of take us through this, because I think these are some really compelling points.
Yeah, so we just, I think we talked a little bit about like pre-COVID, mental health was a big issue. For lack of better words, we were not in a good place. My pediatrician, who I just respect, says it's the polio of our generation. So for her as a medical provider, parents are showing up in her office with kids really struggling with anxiety, asking for medication. And she said it's not the first sign of defense, which is what we know. And she doesn't really have enough, she's not an expert in anxiety and mental health, and she doesn't have enough providers who can treat anxiety. So this is pre-COVID. So this is increased during COVID. And then on top of it, loneliness has made everything worse, right? There's research around that, being lonely and isolated is more detrimental to our health than smoking 15 cigarettes a day. It's like kind of mind blowing. If I laugh, but it's terrifying. So we're coming out of this isolated, lonely era, and our mental health is obviously impacted. But there's small things we can do to really make a change. And I think the first thing is really prioritizing it as a parent or a leader. And, we all have different positions in our lives. So, for me, I'm an advocate, I'm a sort of a speaker and a writer. I can use those positions of privilege. I'm a parent, but, you can, if you're a leader in your company, start to think about mental health and mental wellness in a preventative way and what you can do to really kind of serve your people. And a little help goes a long way. So I think that's the most important. Mental health can sound scary, but it's actually the most hopeful and exciting thing about it is there's many, many things we can do that are just small little tweaks that make us feel a lot better. And the first is just noticing it and naming it.
Well, and you have another graphic that I thought was really interesting because you talk about there's sort of that middle ground, right? Where people are asking questions. They're trying to sort of understand, is this normal? What am I experiencing? So I think, Maddie, if you can put up that slide and Bobby, if you'll take it through here, because this shows sort of those two extremes, right?
Yeah. So many of the, so right now there's kind of two poles. So if we're talking about the kind of everyday person and kind of non-typical mental health consumer, just ask yourself, for the people in the audience, or Stacey, you don't have to say it out loud, but think about all the things we've logged onto Google, myself included. Is it normal to, fight with my husband this much? Is it normal to yell at my kid this way? Is it normal to? These are things we all struggle with, and these are all things that are very much tied to how we feel emotionally, how we feel physically, and how we're relating to people in our lives. And so what we know, so we have therapy on one end that people are seeking services from, and then we have Google on the other end, which is just a black hole, right? There's no human. It's like God knows where the information's coming from. But these are things we know people are searching for. So people are looking up healthy relationships, how to manage stress, things about divorce or work-life balance. And these are like the issues of the everyday, that if we can just deal with this stuff at the front end and in a preventative way, we don't need to get to therapy for many of us. Not to poo-poo therapy. I'm a therapist, love it all day long.
Right.
But there's much we can do to not need those services and just improve mental health and physical health outcomes over the long term.
Yeah, and I mean, the fact that you've got 200 people search, or 200 million searches on being a middle school parent, that should tell us,
Right.
God bless them. I've been there, right? And it's interesting to me though, that range, right, of people just looking for support, so they don't necessarily have to have that higher level of intervention, which is where we end up with cost and access and scarcity. So, I mean, I'd love to hear from you some innovations, right? You're kind of at this crossroads of academia, you're actually a practitioner, you're out speaking, and now you're sort of embracing technology. And I think it's interesting for us as we think about access to care. There are different ways to approach this, right, than the traditional model where you go to the doctor, you get medication, and maybe you get into therapy. You want to share some insight with us on what you see as sort of some promising innovation and things you're working on?
Yeah, great. So by training, I'm a clinical health psychologist. So what that means is I look at everything from a preventative model. How do we make small life changes to improve mental health and physical health outcomes? Things like sleeping, eating, exercise, taking care of our emotions, looking at everything from a biopsychosocial lens. So, I partnered with an awesome team of people, some private equity people, some people actually in the political field, and we've put together a concept called Groups, which is an online mental wellness platform. Actually, Maddie, if you want to go to the wellness wheel slide, that would be fantastic. So, what we are is an online mental wellness platform, really capitalizing on the power of bringing people together, right? I don't need a therapist per se to tell me what I need to change. We all can learn and grow with each other when we actually share and go first and bring up the things we're struggling with. If I can share about the difficulty of, I have a child who has some significant learning disabilities, but when I learn and grow with other parents who are experiencing that stage of life too, we all benefit. So we put together this concept Groups, and we bring people together online, and we tackle things from an emotional perspective, kind of a thinking. We know how research tells us that what we think really impacts how we feel. So helping people understand that connection, looking at self-care and sleeping, eating, exercise. We know social network and community mediates long-term health outcomes. So looking at your relationships and then finding purpose in your life and just bringing people together to have these important conversations with the goal of improving mental health and mental wellness from a preventative perspective. So it doesn't have to be groups. I just suggest finding people to go and talk and just go first. Push yourself to say what you're thinking and feeling. We push all this down, but just try to put words to your thoughts and feelings.
Well, and if you look at sort of different delivery models like this, it's so much more cost effective. And it also gets rid of sort of some of the geographic barriers. I mean, obviously, a lot of folks live in parts of the country where it's very difficult to get access. Like even if they wanted to join a group that's facilitated facilitated by a professional. It's just not available, especially in small towns and
Yeah.
areas. So I think that the cost effective obviously is one factor, but then just having something that's much more accessible. Are you seeing sort of other innovations that you feel like are promising in treatment or even just in broader access?
You know what? There's a lot of great things happening in mental health right now, actually. So the silver lining of COVID has been the stigma is waning a bit, right? So it feels okay to say that I'm anxious or I'm down because like we're all getting it. We're all in this together. So it frees us all up to kind of talk about it. And with that, there's tons of money being poured into mental health innovation right now. So there are different one-on-one therapy platforms that are available. So I think just creating more opportunity for access to people is super, super important. And being online allows people opportunity to connect and get some help. So there's a ton going on in mental health and access right now. And I think we're still fighting the stigma. So I think like people like you having conversations around this is really the change that needs to happen. But we see the demand's there, the supply is catching up, and we're just getting there. All these companies, though, they're super new, like 2019 new. So hopefully the tide's turning some.
Well, I think you're right. These conversations are the first step. And I would love for you, Bobby, to kind of share some of your wisdom with the parents or grandparents that are on this call today, especially with the issues of, like you said, there's the kind of that trauma that students have experienced. There's a lot of isolation. There's been a lot of isolation during really highly important developmental stages for kids. So what advice would you give to parents, first and foremost, just how they can help their kids sort of engage in the next step, right? Because there's some kids that actually did fine with COVID. Now they're struggling to re-engage in their day-to-day lives. And then I think the other thing that would be really interesting is if we've got educators or people that are in the educational realm, we can all impact education in our communities. It'd be great if we're a little bit more equipped about what are some good best practices we can make sure are going on in the schools. So that's kind of two-part, parents and educators.
I mean, those are awesome questions, Stacey. And what we know with all trauma, so again, thinking about COVID as a cultural trauma, is that good, solid relationships help mediate the impact of trauma. So that in many ways is very hopeful to parents and educators. And if you can really look to the kids in your life and build good, solid relationships with them and empathize with the uncertainty or the loss they're feeling, our kids miss monumental things in their life. And it's okay to feel sad or anxious. They've been burdened with uncertainty and anxiety. And don't try to talk them out of it. Empathize and validate that that's a normal feeling. And like the upside of mental health and mental wellness is a lot of it is just focusing on the relationship and really like acknowledging the pain that you're seeing in your kid and just sitting with it. So I know that seems really simple, but it's actually a very impactful solution. And I think even as educators, you know, and I teach in the School of Ed at Harvard, and it can feel like daunting, like is mental health supposed to be in schools? But think about it from a relationship perspective. It's really validating the experience of the children in front of you and just knowing that our kids are coming in with heightened anxiety. And the way you can make them feel safe and secure is just noticing it, naming it, and just sitting in it without doing anything. You don't have to change anything. Just like see the person in front of you.
No, I think that's so important because I think all of us kind of want to, you know, at least type A's like me, you want to fix it, right? Yeah. And that's not the approach. I've learned that the hard way. So I want to bring Andy back into our conversation. And Andy, is there anything that you'd like to add to that? Like making recommendations to the folks that are on here that are parents or educators, you know, anything that you want to add to what Dr. Wegner just shared?
Yeah, well, I think what Bobby said was right on, and I guess maybe I would just add that that I think there were some good things that happened with COVID too, right? I mean, I think that a lot of us became kind of more emotionally aware, not just, like, oh, I'm depressed, but just more emotionally aware of what was going on around us. We talked to our kids more. I mean, I had my kids live with me, my adult children, for 3 months, which was maybe the best 3 months of my life because it was super fun having meals with them, seeing them again. And I now talk to my parents once a week on Zoom. I didn't talk to my parents once a week before that. So I think there's a lot of connections that we found. I mean, in my workplace, we added, I used to be, if somebody had their child with them making noise in the background when they were taking a call from work, like we would all get anxious. Now we're like, yeah, your kid's here. I mean, you're doing homeschool. I think a lot of us have just normalized that we actually have lives outside of work that are kind of interpenetrate with the rest of the world, including school. And on the one hand, that's super stressful. But on the other hand, if we can kind of maintain that, what I kind of think of as emotional permeability, kind of just being more emotionally present with each other, I think I'm a better leader in my company than I was before because I'm more, willing to talk about these things and engage folks, share my own struggles. I felt that was super important and so I think as parents, just normalizing that this is part of life, and I have feelings and you have feelings, and that's normal. And I love that wellness continuum, Bobby. I mean, I think that's really associated emotions. Oh, that's bad, especially in the workplace. Oh, they were emotional. Like we had this whole stigma around emotion. It's like, emotion is actually the whole reason to live your life. So, so I think those are the kinds of things, but it's pretty much what Bobby said.
Yeah, and I think what's something that's been brought up in our questions, right, is we've got a question from Lisa Schmidt, and she's saying, we need to end the stigma. And I think that there is definitely a push in that direction. I love the fact that Bobby actually used the phrase "okay to say." Andy's over there like, yes, well done, because that's something, Andy, that Meadows has been very kind of at the forefront of that issue. I mean, years ago, launching that campaign, "Okay to Say." Can you tell us a little bit about what you think in terms of, I mean, there's obviously some progress, but do you have some data? Are there some numbers to sort of share with us about stigma, or you can share kind of how that's changing based on some of the work you guys have done?
Oh, sorry, is that for you, Andy, I think? Yeah.
Yeah,
right. It's hard to see. I mean, we've surveyed, kind of stigma levels, and yeah, did I freeze? Am I there?
Yeah, you're back.
Can you guys hear me okay? Oh, sorry about that. Yeah, so what we did is we've surveyed, right? And we see that there's correlations around education levels, around income, that are pretty much associated, and age. So the younger you are, the more educated, the more income you have, the less stigma you have. And we've looked at that, and we've also looked at how stigma went away with past conditions like breast cancer. When Betty Ford said she had breast cancer in 1974, the B word and the C word were not commonly used. And so, in self-exam right before, like within weeks of when it occurred, she talks about, my mother's very conservative religiously. She does not talk about her private body parts, but she does talk about her breasts because that's part of health now, right? So part of it is like helping people understand that, and this was really powerful statement made by a person who suffered with long-term depression to me. She said, why would I talk about something if I'm hopeless and don't think I can get help? And I think that's one of the biggest things with stigma is we're afraid that we won't be able to help. Do you help the loved one get help? How do you overcome the sense that if I talk about suicide, I'll make it worse? No, you will not. You will actually make it worse if you don't talk about it. So just helping people see the utility and that they can actually do something and give them hope, we think is the biggest way that you overcome stigma.
Yeah, and if I can add to that too, Stacey, like, at least with groups, people ask like, why groups versus individual? But what we know is that when someone goes first, it gives other people permission to go too. So forget about mental health stuff and exercise or other things. When somebody like discloses and leads, other people follow. So it accelerates connection and mental wellness and all this good stuff. So, even if you're at work, or it's like, how can you be that person? How can you just push yourself a little bit to kind of go first, to notice it, name it, say it, and go first? And especially if you're in a leadership position, I put a little bit of pressure on you to really think about your role and using it as a position of privilege to actually make an impact.
Well, and I think I shared with you guys earlier, we hosted a roundtable with some women utilizing the policy circle brief on mental health. And a takeaway was the CEO said, I'm going to go share with my team that reemerging from COVID and everybody back in the office that I am actually struggling with my mental health. And she wanted to set that tone, right? That we're going to be transparent and authentic with one another. And, that's a massive shift. Mm-hmm. And especially in a corporate setting. I mean, we were in New York, so she's going to go into a corporate setting in New York. So that gives me a great deal of hope. Yeah. And honestly, the policy circle, when you talk about courage, even convening people, which is a big part of our model, requires courage. And it is kind of going first, right? You lead, and I think that's a huge component to this. And another question that we have, and Bobby, I'd love for you to sort of take this first because you have done so much advocacy. How can people that really care about this issue, like I really care about this issue, mm-hmm. How do you recommend that as sort of everyday citizens that we can be better advocates for fundamental change in how delivery methods, obviously, but how can we be better, stronger advocates for mental health issues in our communities?
You know what? I always think change starts with you. Honestly, this is, it is a parent. It starts with you. It starts in the home, but it really starts with you. Your kids are even like second. It's like using that oxygen mask as a metaphor and appreciating that we are in a rough place as a culture in terms of mental health. So you're not alone if you're feeling stressed, anxious, a little depressed, maybe drinking too much. Many, many people are in those boats too. But take stock. So first is stopping, noticing, naming, having an honest conversation with yourself, doing something different, and then being vulnerable. Vulnerability is a huge piece of this, and kind of owning your own piece of this, and then making an effort to do something different, whether it's just for yourself, in your family, or in your organization, or in your community, or even at a bigger scale. Mm-hmm. There's a really good book I read recently for those people in the audience in a more of a corporate field called Culture Code. And it talks about the importance of creating good culture through providing a space of psychological safety and vulnerability. And it used all different types of organizations as who've done this well. It was just a great, great read, super fun if people are interested in learning more about that.
Yeah, and you know what? I think that culture, it really matters, right? And backing up that culture with resources, I think, is the next step. If you're in a position of leadership and you can provide more resources mm-hmm. and point people to those next steps, I know that's really important. And this is a really incredible insight that somebody just shared in the comments. And Andy and Bobby, I don't know if you can see this, but Patty Kajawa, I want to share her name, that her son died by suicide. So Patty, first of all, unbelievably sorry to hear that, but you're being brave, obviously, and going and speaking about this, and that she's amazed that people still come up and whisper, right, about what's going on in their lives. So when we come to sort of normalizing this and talking about it like physical health, Andy, some suggestions. You had talked, that graph that you gave us earlier was really great, kind of talking about that, but how can we get this integrated care, right? This is like physical health. Let's kind of get with the program. How do we do that?
Well, the big barrier is just getting startup because it's paid for now. Like every health insurance company covers it. We just have to redeploy. And a lot of it's retraining. A lot of us, Bobby and I, who were trained as clinical psychologists, we weren't trained necessarily to function in an integrated setting. And so it's a different flow. And so I think a lot of it is working with our institutions to make the pivot. 10 years from now, it'll be normal. But if we can accelerate that transition, we'll save tens of thousands of lives.
And are there policies?
Can I just maybe add too about? Go ahead. No, go ahead. Go ahead.
No, you've got a lag. So finish what you were going to say.
Well, I was going to say with Patty's situation, which also Patty, thank you so much for taking that leadership stance. We aren't going to be able to save everyone, right? We're still going to lose folks, and I think that's an important thing to keep in mind. Because like we lose folks to cancer, we lose folks to heart disease, but we don't leave people alone. We talk to them. Our faith communities reach out. We as a community embrace people. And so we will do our best and we will save a lot of people from depression with people and try. And even if we don't succeed, we'll be with people. And I think that's a really important thing to keep in mind.
No, I think that's really powerful to be willing to continue the conversation, right? Regardless. And so I just want to thank everybody that, chimed in the comments, and, Bobby and Andy, thank you so much for the work that you continue to do in this space. I really admire you both have very different tracks, but it's enormously effective. And just again, thank you for sharing your insight. And just so everyone knows that there will be a recording of this on our Policy Circle YouTube channel. I encourage you, if you want to share this with folks, we'll have it posted in the next day or two. But I think it's really, there's so many valuable resources. So thanks again. And I look forward to continuing the conversation with you both down the line.
Thank you, Stacey.
Well, and before we wrap up today, I want to sort of share some suggestions on next steps. First thing, host a conversation, right? Use the Policy Circle brief, gather your adult children, gather high schoolers, gather your family, gather your coworkers. A takeaway for us is that these conversations need to be happening, and the brief provides an excellent overview and a discussion guide that will help guide your conversation and make sure that it's productive and action-oriented. Also, Dr. Wegner has generously offered for anyone that's participating in our program today to take advantage of a friends and family offer for the brand new groups platform she's launching. I, for one, am going to sign up. I think it's going to be a tremendously helpful tool. And I think we should all be considering this as part of our wellness routine, right? You have your health club membership. You should probably have some sort of platform that you can plug into to get this valuable resource. Lastly, look at the Meadows Mental Health Policy Institute site. They have valuable resources, including some things that you can share with educators, the faith community, and the business community. There's also a link here if you want to see how your state ranks in terms of the prevalence of mental health issues or access to care. So a lot of takeaways. I hope that you feel activated and that you're feeling more equipped to tackle this issue again with knowledge and compassion. We want to thank our generous influence partner again, Arlie Weldon. Thank you so much for supporting the Policy Circle. And lastly, if you found this program to be useful and compelling, we need your support as a nonprofit organization. So if you would like to join our community, it's $10 a month or $100 a year, and it gives you access to our Policy Circle briefs. We cover 55 different topics, just like we are with mental health. These are valuable resources, and we need your help financially to continue to provide these to as many people as possible. So again, I'm grateful for your time, and thank you for your attention. And please reach out to us, email us, send us any questions you have, and we're happy to share these resources with anyone in your network. So thanks again, and have a great afternoon.